Did you say episode 8? Dang, that's wild.
Yeah.
It's still single digits, but pretty cool.
We're getting there.
Welcome, guys. This is the Second Opinion Sports Medicine Podcast with Dr. Dhokal.
Dr. Glass.
We're the pro sports doctors here talking about sports medicine, wellness in general, and also this week's NFL game since it happens to be NFL season. So that's what we're chatting about today. And it's good to see you in person. Last week we were Zooming it.
Yeah, that was an interesting experience. I think we did fine.
I don't want to sound so naive, but I don't normally Zoom or do, any sort of computer type electronic stuff like that, right? And so there was like 10% of me that was like, this is going to not go well. Yeah. Like I'm going to hit mute and be talking for an hour or something, So I'm glad I was able to pull off a very basic thing that the rest of the world has been doing for the last 2 years,
Yeah, no, I think we did good. It got
was
done.
fun.
Anytime you could do it in one take, it's all good.
Yeah, well, that's what I appreciate about us. We can sit down and have a conversation, and at least to me, it's interesting. So, but last week was fun, man. It was good to be in SoFi and be in the parking lot.
Yeah, how was that experience?
Dude, it was good.
Yeah.
As expected, there was a lot of traffic, which I accounted for, but I didn't account enough for, so I got there a little later than I wanted to. I kind of missed the Qualcomm days, I don't want to be nostalgic on old stadiums, but at Qualcomm you could go tailgate, you could get there hours before, and here at SoFi it there's signs up, no tailgating.
Oh really? I haven't been there yet, so so tell me a little about it.
Yeah, it's expensive. So that's probably first and foremost if you're parking in the actual stadium parking lot. But I think the days of, pulling up to a ballpark and paying $20 for parking are probably gone, especially at these newer stadiums. But, I bought my ticket online on the way to the stadium for the stadium parking lot because there was traffic and I was running late. Normally I kind of park in like the Jiffy Lube near the stadium and walk a little bit, But so I think there was a little bit of a markup, but parking was, it was triple digits. So,
whoa,
yeah. And I'm not talking $100.
Yeah.
It was like closer to the $200 range than $100 for parking. So I was like, this kind of sucks.
That takes away from it a
little bit.
I had no clue. Wow.
But also it just made me think that when I was younger going to ball games, boy, my dad would not have been paying $200 for parking, right? Or even $100. He'd say, wow, yeah, we're going to watch this at home or listen to it on the radio. So it did make me think of if you were going to take a family to a professional sports game, it can be financially limiting for a lot of people to go on the regular, So it made me be appreciative of sometimes being able to go for free and, just having a little bit of a hookup sometimes, like it is not cheap to go to a professional sports game. So we had a good time for sure. The energy, even though there was no tailgating, like I said, people were still hyped. It's Monday night, right? It's a weekday. You kind of feel like you're playing hooky a little bit. Maybe people left work a little bit early. Yeah. So the energy was high. The stadium was full. The game was a little bit boring. There was a lot of field goals in that game. However, the Chargers field goal kicker did kick a field goal in overtime to win it on a bum leg. Not his kicking leg, his other leg, his plant leg. But, man, clap it up for that guy because he hit some clutch field goals while he was injured. And kickers kind of, they get kickered a little bit, right? They don't get the same type of respect unless you hit that game winner. And I think you have to be so mentally tough to be in a position of converting in a pressure situation. And kickers are that too, So it was fun to see the game end that way. It was in overtime. We got the W. More recently, this last Sunday, yesterday, we lost, Chargers being we, but that's how it goes in the NFL. Some weeks you win, some weeks you don't. But the game was fun. We ought to go sometime.
Yeah, I'd love to.
Yeah,
love it, especially with your perspective of it. And would love to do that.
Yeah,
on your dime.
Yeah, no worries. We'll take you. We'll go. Maybe we'll make a
side bet. Throw that out on the air.
We'll go with the Chargers Raiders game, and we'll see who gets reimbursed depending on who wins. Maybe right. Fair enough.
Sounds good. That'll be fun.
I am going to the one that's in Las Vegas here in a couple weeks.
Are you?
I think it's the first weekend of December. Yeah, so I'll be going back to that stadium and catching that game out there, which hopefully we pull out. It's a division game, so that's an important game for both teams. And I'm looking forward to seeing that. The energy always in that stadium is great. I think it was so smart for them to move a team to LA. I mean, to Vegas. Las Vegas is what I meant to say. And yeah, it seems like they're doing well fan base wise, and it's a good venue. You know, it's a good, fun place to watch a game.
Yeah.
So, well, tell me about your week, Dustin. What's been going on since
let's see.
I saw you via Zoom last Monday?
Yeah. Man, last week was a blur. Thinking about what's good. Something that I kind of reflected on in the last month, so not just last week, but this week and last week, I received thank you cards.
Did you really?
From patients.
Wow.
And it's not a holiday, right?
Yeah,
and normally we get them on holidays, and people, you know.
I don't get them during holidays.
You don't? Well, sorry.
Patients send you thank you cards?
So, we'll talk about that off air.
For better outcomes.
You're right. But to get random, like in the last month or so, 4, and it just kind of touches you a little different when it's a surprise, right?
Sure.
So I had jury duty today. I got called in. So luckily I got dismissed. So I could work and do what we do. But so anyways, I came in on Sunday for some patients, and I showed up on Sunday, random day, and there was a card on my desk.
Oh, nice.
Yeah, just waiting there, and so it kind of
somebody mailed it in or left it for you?
Somebody left it there. They were in there see my massage therapist or the massage therapist in my office, and just decided to leave me a note.
That's nice.
Yeah, this particular one. Elderly patient was going through some stuff and with some family, and it was one of those where your table is more of a therapy table session.
Sure.
So some tears were shed, and you know, a lot of times the patients are face down, and they just kind of part of that release, not only physical but it's emotional, and they're telling you stories about what's going on. And at this particular session, she just needed to have a good cry, and she had a good cry, and you know, we do our thing, but
for sure.
Don't realize how much it means to them. So, but I guess it really meant a lot to her.
Well, it just tells me that your office is a safe space, not in the, I don't know, politically correct term, but just, you know, it has to be a place where people can be comfortable if they want to heal.
Right.
Whether you're doing physical therapy, whether you're doing chiropractic, whether you're at a doctor's office. I think being comfortable is really important to healing.
Yeah.
And along those lines, you know, I think that happens often. And as a, you know, practitioner, I'm curious on how you felt, but, you know, during the last couple of years, there were some times where I was really drained is a good word versus fatigued. And I love to have those relationships with my patients. It's, you know, I think something that you have to build up to, right? But there was times when I left during, say, the COVID period, and when people were going through stuff, it's like everybody was going through something, and not everybody had a space or somebody to openly talk, right? You're at home and you're stuck. And so, you know, I really loved those days. They were kind of a blur, but we never talked about it. Like, I mean, how did you keep your energy, you know, protected, I guess, is maybe one way of putting it. Because I definitely left sometimes feeling drained out from like just the heaviness of what people were going through. People were losing family members or just having financial problems or marital problems, or
a lot of fear-based during that time.
A lot of fear-based stuff, right?
Because it was very
tough.
Confusing. You know, people didn't know what to expect, you know, especially when it first happened and everything shut down for a while, and people were really scared. We kept our doors open. We were essential. So our doors were open, and so we still had people coming in that felt safe enough to come in and wanted to come in, and we were welcoming it because we know how, you know, regular, you know, chiropractic could help with the immune system. And so yeah.
Did you ever feel drained during that period or did you feel a shift in your patients who were coming in? And
definitely a shift. The ones everybody that was coming in was like-minded, right? So they were more of the fighter type and wanting to be proactive about it. Yeah. So it was more of the mentality was a little different, but it was interesting because in the beginning it was a lot of that proactive, we're going to stick with it, we're not going to let this affect us. And then as it was going month after month, then you started seeing the drain come, then the fear-based, is this going to end? Because in the beginning it was like, this is only going to last a week,
right?
You know, and then it was weeks at a time, and then people started to actually start questioning things. Work started changing, finances, like you said, marital stuff, because now you're in the house together, you know.
It was just such a shift for everybody, right?
Right.
And
so our mantra was, so I kept reminding, and to keep it as simple as possible, we would tell people, listen, you got to understand the virus, right? And we just called them our bugs, and the bugs love sugar and hate oxygen. Okay, so that was what we kept talking about and repeating, you know. So if they hate oxygen, well, let's go do our breathing, let's go do our exercise, make sure you're doing active, something to keep the blood flow, the oxygen going. So if you do get in contact with it, at least you're giving yourself a fighting chance. Also, don't be feeding it what it likes to eat, you know, so sugar, you know. So
some very basic, simple,
keep it simple at that
take
point.
Home that people can understand and
so
digest.
To answer your question, that's kind of how we would, you know, work on combating it, to keep it as simple as possible. Because we still didn't know enough about the virus, right?
Yeah.
So we just took it from the basic standpoint.
But energy-wise, you felt good though. You didn't feel any type of way.
It was kind of a shift because the numbers of people coming through was not. So I had a lot more energy.
Gotcha,
I was able to do that. But from an emotional standpoint, it was really hard because you take it all on. You're like a magnet, right? So not only are you dealing with your own stuff, you're dealing with every patient's stuff that's coming in that wants to unload it, right?
Right.
So you take it home, or take it on. So the key is to, once you leave the door, to drop it off, right?
That's it.
Don't take it home with you. So that's the key. And I think everybody kind of that does what we do has a little thing that they do before entering the house, or we should at least learn to practice that, right?
Sure.
Don't enter the house and bringing all that in, right?
Well, that's
not
easy
what I was to do.
Curious about and getting to is what is your practice? Is it after every patient? Is it like before you leave the office?
Yeah.
Because there's a little something that I do too, but curiosity wise.
I have a practice where, because my whole philosophy is every time I enter the room, I want that patient to feel like they're the only patient of that day, right? So it's that Disneyland experience.
That's the most important one.
Right. So, because to them, it's all it is, right? So they've planned their day. Sometimes they've planned their whole day around coming in, and they've looked forward to it. So our job is to give them that experience and try real hard, even though you might have had 10, 15 people prior, you know.
Got to reset.
Yeah. So every time I go in, wash my hands before seeing the next patient. Behind closed doors, I'll do, you know, a shrug row press type thing, right? I'll do a little thing that resets my nervous system.
Gotcha.
And so that's kind of mine. And I do a little breathing, and it takes literally 30 seconds, and then I walk out, and it's kind of like you clap your hands like the LeBron, you know.
Yeah.
And you go out and enter the door, and then
I think
it's
something
game time.
physical, something audio, you know, something that is needing some focus is effective. There's days I left here and I had somebody who is, you know, in the healing profession as well. And despite, you know, I didn't really know her too well, but she was saying when she met me, like, hey, you're seeing a lot of patients today. Is there anything that you do? And I was like, you know, not really. I go take my dog for a walk. You know, that's basically it. But I was at one point feeling a little bit fatigued from my day, and it felt a little more than normal. And her thing was just very simple, like, hey, just wipe it off, you know, just like wipe it off, right? And so I started to do that at some point in time at the end of my day. And, you know, it's like dusting yourself off, like Jay-Z, brush your shoulders off. It is a little bit, you know, it doesn't seem like much. But I'm telling you, if it's effective for me, sometimes I'll get a little bit of the chills, and sometimes it just feels like, okay, I'm fresh, I'm ready to go. Like, let's move on to the next thing. And if nothing else, if it's just like a mental thing that I'm doing, it is something that I'm putting some focus on. And then it's like consciously, I'm like, all right, let's move on to whatever the next thing is and bring that focus. And so kind of like when you used to wear a rubber band and maybe snap your attention. Any of those things are effective. But anyways,
I love that.
Yeah, I was curious.
No, I think for me, coming home to the 3 kids at home, and then the wife and the dog and the cat, and coming home to a lot of energy, right?
For sure.
And you're tired. So a lot of times I'll get into the driveway, shut the car off, just close my eyes, pure silence.
Yeah.
And it's kind of that eerie silence.
Yeah.
And I just give myself 20, 30, a couple minutes sometimes,
Mm-hmm.
kind of reset, take my breaths, rethink, refocus, and then go in just like I would with my patients. Because, it's not easy. It's not easy with the patients. It's not easy with the family all the time.
Yeah.
But trying to make that conscious effort, and it doesn't always work, but
what's crazy
can't
is
always be.
when we were in school, I used to think that the hardest part was, we got to get people better,
Mm-hmm.
and not by like leaning on, hey, take this, and then this is going to numb your pain, and then you're going to feel better. It's like we're doing something with our hands, whether it's stretching or manipulating tissue or adjusting the spine, and you want the outcome to be, I hope this helps you feel better.
Mm-hmm.
And so I used to be like, man, that's the most important thing. And now, knock on some wood, but it's like kind of the second thought, like getting people better is like kind of what we've developed a skill set on learning how to do, right? And so that's almost like the easy part, and helping people understand the treatment plan, or helping people maybe sometimes navigate life outside of the office, just helping them as a friend or as a doctor is the challenging part.
Yeah.
It's a lot sometimes, but it's also super rewarding. And so going through that time, I know you were working through the whole time, and there was definitely times where I felt like, man, my energy, I feel taxed.
Yeah.
Like I feel tired. And so I think silence is a good thing. A lot of people talk about meditation, and people ask me about it all the time. Well, not all the time, but
comes up.
Frequently enough, it comes up. And there's confusion, like how do you meditate properly, or, what do you do? Athletically speaking, I'd love to have a whole podcast on being quiet, being still, and how that helps your focus. But essentially I just say, hey, just start with staying quiet. Just pause, turn off the radio. So what I do is when I'm driving home, sometimes, music off, podcasts off, and just drive and just listen to your car, or just listen to, the thoughts in your head.
Just be present.
Be present. Recognize what's going through your mind, or if there's something that's rattling around back there. If you're always kind of, the front of your mind is a little bit focused or distracted because you're flipping through Instagram or scrolling through TikTok, or you're, listening to music, or you're watching TV, then that thing that's rattling back around there that you're trying to think about or figure out, I don't think ever gets resolved as quickly as you can, So I think that silent time in the day is important. So I try to catch that on the dog walks, shower, when I'm driving.
Yeah.
Just capture those moments. It's not always 10, 20 minutes. Sometimes it's 5 minutes, but for me, it's helpful. Maybe to other people, it's, kind of hokey or nonsense, but I know a lot of athletes that definitely catch that quiet time because life is noisy.
Right.
You have work duties, you have family obligations, you have media obligations if you're an athlete. And so I think that's important,
Yeah. I think it's important, like with my patients, and I think you agree to this too, because we've talked about it, but it's giving them permission to figure it out on their own, figure out what makes the most sense to them. Because some of my ADD people, ADHD, they can't sit in quiet. Like that will drive them crazy,
That's a good point.
So then I tell them, I said, okay, well, that works for me. The quiet works for me, but figure out what works for you. They need to be doing something, right? So, and that's their meditative time. I said, it doesn't really matter. You can call it whatever you want.
Just be focused on something.
Just have a plan of doing something. So, so, but what about you? What was good in your life this week?
Well, good week overall. We, like I said, last Monday night at the game, so that was my first game at SoFi this season, and it was fun to go to that. Productive week, good with patients. Had a couple patient outcomes that were positive. I think we spoke on PRP last week. That patient did subsequently end up getting a PRP injection in his knee, and good, yeah, really good. Actually, I didn't expect very much input or feedback in for a couple of weeks because I don't see him till next week, but he texted me on Thursday, I think it was, or maybe Friday morning, and was telling me like, hey, I can already tell this feels better. And I said, well, what exactly? He's like, in the morning, I'm not as stiff. Like normally I'm getting up and it hurts. And like he was saying he couldn't cross his legs without pain. He's like, I'm crossing my legs. So these little improvements of daily life for him have already started to take effect. So that was nice.
That's
good.
It was a win.
It's a win because it's an unknown. You always give your best advice to a patient on what you think may work, and it's different for everybody. That might work for me and you and Steven and Manny, but maybe not Kelsey or Terry or Zorka next door,
Yep.
And so it's different for everybody. In this case, it was a win. The PRP helped him, so that was nice. And I guess this is worth mentioning as well. I had another patient who had some back pain kind of by the scapula, shoulder blade, and it was a little bit unresolved for a few weeks. Normally, if somebody comes in with that between the shoulder blades, you're like, okay, I kind of know what it probably is. You've been slumping, you've been head forward, you've been in poor posture working, and you develop these things, maybe a rib head's out, or maybe
just... a few weeks ago, we talked about that T4 syndrome or that
absolutely,
rib area,
we did mention that. Yeah,
that's where
right.
our head goes to, right, when they talk about that.
Absolutely.
Between the shoulder blades.
Yeah, you're like, okay, I kind of know what this is, but let me hear you out. And so we've had a few adjustments, improvement, slide back, improvement, slide back. And so I'm not necessarily accustomed to the slide back. And so we took some x-rays. He was like, should we not? And I said, if you haven't had it, let's take a set. At least it's a baseline for the future. If something, God forbid, happens in the future, you can say, hey, at 2022, this was my spine. And 2024, obviously there's a change there,
What age range was this patient?
Let's see. He's probably mid-30s, early to mid-30s, I would say. And so you wouldn't expect like a chronic issue in that area. And so we took some x-rays, and he has a little bit of scoliosis right in that area of reoccurring, frequent, significant pain sometimes. So normally we manage it. It's pretty low. Sometimes it gets bad, and he's like, he was like, hey, I went down the Google rabbit hole, and like I really started to get concerned because his pain he was on a trip. And at first he thought, well, maybe this is related to stress due to work. And so he was on a little vacation. He's like, man, it got the worst at my vacation, So long story short, we took some x-rays, and it was just another reminder that as sensitive as my hands are, sometimes nothing beats taking a picture and seeing it. And also, it's not a money grab to take x-rays. It's really, it gives you more objective data versus subjective data of like what I feel. It's objective data of like, this is factual. This is this many degrees. It should be this many degrees. And so that yielded some information that was actually very helpful for us. I said, hey, check this out. This is what's going on. That explains, if you ask me, why you were having that exact pain and issue there. And so,
and why it wasn't resolving as a normal.
Correct. Yeah. That's more of a long-term thing. He's probably, he could have been born with that, and maybe over time it's gotten worse. So that's why the x-rays are important. If we had something from 3 years ago, we could see, has it been progressing from 8 degrees to 12 degrees to maybe 2 years from now, 15 degrees, or is it, totally stable for the whole time?
Let's talk about that, about scoliosis, because a lot of our listeners might have a little, most of the time when I mention scoliosis to a patient or say, hey, you might have a little scoliotic.
Scary term, right?
Big time. So they go right to Quasimodo, Disney character with the hunchback. So kind of tell me your experience with the scoliosis.
I see it in their eyes, when I say that word, I almost don't even like to say it.
Because
me too. It's like, it's like if
and
somebody says.
It's so common. I can't tell you how many of my pro athletes have scoliotic curvatures that it's a non-issue, but it's good to know about because the way I talk about scoliosis to my patient, I'm like, look, you've probably had this for a long time, okay? At this stage, especially somebody in their 30s, it's not progressing, okay? But we want to make sure that we're going to monitor it because it's going to affect things, right? The musculoskeletal and how you move. So,
especially if you're trying to perform athletically, you might have a restriction or you might have, a weakness.
But the biggest take home I tell them is, listen, it's nice peace of mind to know why. The biggest thing that for you it's going to be, this is going to explain why you might have a little more tightness or restriction doing the same thing that your neighbor's doing, but sooner, right?
Correct.
So whereas they can go and play tennis or play around a golf, where around a golf you're at hole 6, you're having issues, and they can make it all the way through. It just explains that, but it doesn't mean you can't do it, right? But if we have the knowledge, then we're going to come up with a game plan to make you be able to perform without even having an issue.
Scoliosis can be improved in some cases, right? Not in all cases, but in some cases. And sometimes even still in 2022, there may be people who are like, oh, chiropractors like do they really, like, what is their function? What do they do? There's certain things that are right in our wheelhouse. And I've seen colleagues of mine take x-rays pre and post just after 6 months or 12 months and make a drastic difference in objectively changing the curvature of somebody's spine and making a quality of life improvement. And so for me, when we take films on patients because it's indicated and then we see something like that, then there's a game plan depending on age, depending on what their activity is, what their goals are. It's like, okay, here's our game plan for it. It changes. It goes from, hey, we're running a 5K to now we're running a marathon, if you want to really change it. And also maybe we modify some things. If you have a crazy curve in your low back and you're an avid golfer, I mean, I'm not saying stop playing golf, but I am saying like, hey, every time you play golf, you better do something to unwind or protect yourself. Otherwise you're not going to be playing golf. And you're messing up. So sometimes you got to break it down like that.
Yeah, I think it's good when we do get those pictures. I typically tell, hey, this is not terrible news. At least we, like you said, at least we now know what's going on, and we have the rest of your life to make sure it doesn't progress, because that's a weak link in the system right now.
Correct, yeah.
And we want to make sure that it doesn't progress into some arthritic joints or, other issues. Because down the road, when you're not moving as much as you are right now, it's going to start showing up as a bigger problem with your lungs, and depending on where it is, lung, heart, it only have so much room. If you can't move fully, it's going to affect some things. So
look, if you have a car and your air is low in your tire and your alignment's off, you want to know that. If you have a sensor in your car that tells you that before your wheel flies off, before you have a blowout. And so sometimes I really trip out on how people care more about their vehicles than they do about their body. It's like the same analogy, like let's prevent stuff versus react when something has a blowout. It's like, God dang, now that's really, really tough. Like, it's really tough. And so sometimes having that knowledge is frustrating when you see something that's preventable and it happens. It's like, oh man, that's frustrating. Okay, well, let's start from where we're at now,
Yeah. So how do you explain it to that patient? Because I think this is a good case that comes in a lot of times, because this patient's having some discomfort. Typically the adjustments will help, and they're not helping right now. And then we take an x-ray, and they came in obviously not with the obvious what we call rib humping, because the
visually you wouldn't say that person has a crooked spine or a weird back.
So this is one that no obvious or signs and symptoms. Get the x-ray now that it's noted. So what's kind of the game plan for them? Or
so with this particular person, they were desk bound a lot. Right now they're in between. They're taking like a little hiatus from work. And so I was like, this is golden news. This is the best news ever, because now you have this window of time that you normally wouldn't have if you were working. You'd have to squeeze it in before work, after work. And so our game plan is like really a couple pronged, right? One is we're going to continue to adjust his spine to keep it from getting stiff, or at least improve motion in that particular segment. That seems, without getting too nerdy, his spine is has a little lateral deviation to it, but also some rotation to the spine itself. And so you can actually manipulate the deviation or the rotation of the spine. And so we gently adjust it to do that, and then also address the muscles around it. So in my office, we're doing tissue work. I do a lot of manual tissue work, active release, or just manipulation by hand from my massage therapy days. We'll do cupping if we have to. I'll refer out for acupuncture if that's helpful. But typically we're going to adjust it. We're going to do muscle work. And because he has the time, now we have him doing some band stuff. So in this particular case, his rhomboids, the muscles between your scapula, basically between your spine and your shoulder blade, you have muscles. Those are your rhomboids. Those are weak on him. So just doing some band work. He's super contracted in the front, like almost like a book case study of what you would expect for someone who's desk bound. So we're working on that, and it's not a lot, right? Like you don't want to do 3 hours of rehab a day for something that you might have had forever. But look, once you discover that you have a weakness, like you called it, a weak link, I'm a big believer that you can do 5-10 minutes a day over a long period of time and make an improvement. It's like, it doesn't have to be a whole lifestyle change. It could be like, hey, I'm adding this 10-minute routine at the end of my gym, or I'm adding this 5 minutes of work at the end of my run to either A, prevent, or B, improve this situation that I have. And so that's kind of how I'm treating this particular person. Is there anything that I left out that you would do differently, or
no?
That you've done with your cases?
I like those cases. I mean, knowledge is power, like you said. Once they have the knowledge, I love getting those X-rays, and once they see them, we can tell a story. But a lot of times they'll ask me like, "Well, Doc, you tell me nothing caused this scoliosis that we know of. There was nothing obvious. If the only reason I took the X-ray was because the treatments weren't fully clearing it out. So." If the scoliosis has been there for a while, why am I having the pain now?
Sure.
So how would you explain that typically?
That's a great question. So if it was a multiple choice test, I don't know would be in a selection.
Which is a fair thing to say to people.
Yeah, well, I mean, if you don't know, then you tell them you don't know. Like, hey, let's figure this out together, to be totally honest, right? But that would be private selection D or E, right? It wouldn't be like
you
number
jump
one
right
or two.
To that, yeah.
But, in this case, he had a change in lifestyle, right? So it could be, look, when we were in chiropractic school, I would be healthy as could be. And as soon as we took finals, we had a week off. And once a year during that quarter break, I got sick, and it was just like the letdown. And so I said, you're in a stressful work situation for 2 years. It was this thing where, without getting too detailed, he had to really slog through some stressful times through work. And then he finally was like, okay, this is my date. I'm unplugging. I'm out. And he did. And him and his wife went on a little break. And I said, it could have just been that you can't break down till you get, we went and worked the Ironman World Championships, and you'd see people after a 2-mile swim, a 100-mile bike ride, a 26-mile run, and literally they crossed that finish line and they collapse.
Yep.
And you're like, yo, you just ran 26 miles. You couldn't make it.
Yeah.
Because I worked the medical tent and you'd have to pick them up from the finish line.
We're called catchers because we literally catch them as they're falling.
And then drag these sweaty after a 100-mile bike ride. When I was...
Sweat's the best thing.
If you're sweating at that point, you're right. But the first couple of years that I went, I was like, couldn't you have just made it to the cot? But getting to my point is sometimes you make it to where you have to make it, and then
your body lets go.
So that might be, part of it. He started working out again since he, quit his job and had more time. He's like, I'm going to dedicate more, do something for me. So I'm getting back to doing what I like to do, which was working out. And so that could have had a consequence if you jump into it too quick. Or sometimes you could be doing everything perfect and you're a little fatigued or a little dehydrated, and you decide on rep 6. I tell all my patients, clients, athletes, whoever, if you feel something, don't keep going.
Right.
Just stop.
Yeah.
Right. And I did that myself. One of the worst injuries that I've had, I was trying to do pull-ups. I have a player who wears number 94, and one day I was feeling jacked. I said, I'm going to do 94 pull-ups today. And he said, get it, do 100. Yeah. And I said, all right, So I went to the gym and I did sets of 10 pull-ups. I got to the 9th set and I was gassed. I got to 93, 94, and I felt something pull. And I was like, well, I just got 6 more. So I powered through the other 6. And by the time I let go, I'd pulled and strained and hurt something, and
didn't listen
to my body. Right. So that's something that could have been a cause of it. And that's something I always tell people is you don't have to, there's no one watching you. It's not the CrossFit games. Yeah. If something happens on rep 2, set 1, you can go home. Yeah. That's not the day for it. Any of my athletes, if you're a quarterback and you feel something funny in your shoulder on the first 5 minutes of practice, you don't continue through practice. You assess it and deal with it. So to go back to answer your question, that's, what caused it. I'm not 100% sure, but it could have been a combination of all those things, a decrease in stress, increase in the gym. Sometimes emotionally things cause physical pain. Yeah. So who knows? But we have a plan for him, and it was just a reminder again that sometimes people don't want to take films, and I have no skin in the game. I don't make any money off taking films. It's really for to inform us on what's happening, but it's helpful, So sometimes I wish I had an X-ray machine here because I would take films on many more patients. Maybe all of them, just to have a baseline of where they're at health-wise, because it always reveals something that I didn't expect it to reveal, and then it also opens up discussion, which maybe that's more important, But so in this case, it was helpful, and I think moving forward, I'm going to remember that. Just sometimes I get these little reminders, and I'd like to keep that little gem in the back of my mind for the next time something doesn't resolve in 2 or 3 sessions when I know normally it does. It's like, well, do we have to go 6 sessions in intake films? We could just do it now, you know? So that was my reminder on it. And both those things kind of made me happy that we were able to figure it out.
Yeah, great.
Yeah.
That's good.
Yeah, I mean, it was just another week, you know. But as we talk them out, sometimes I'm like, man, that was a lot of steps, and we just field it as it comes, right?
Yep.
Yeah. So what else? What else has been going on with you work wise? I want to get to some of the NFL games.
Yeah.
Did you catch a couple games? I wanted to talk about a couple with you specifically.
Yeah, I watched the Green Bay game. That was crazy at the end. I don't know if you saw that.
I didn't catch it.
A lot of laterals, a lot of Rodgers trying to make something happen, and they came up short. But I feel bad for him. That's a game that next week I'm going to be watching too. We'll talk more about the next week's games, but
well, it's interesting about anyone who's really skilled. One is, for any sport, you're a fan, you're a fanatic, you know, so you don't have to have logic as a fan. I saw some things on social media, but just based on our Chargers loss yesterday, that made me kind of scratch my head. But then I'm like, these are fans, right? Like, you don't, this could be a 14-year-old kid, you know, who's hyped up on soda on the way to school, or it could be, you know, it could be anybody, and anyone's welcome to their opinion on it. But, you know, when you have a talent like Aaron Rodgers and he's struggling, or the team is struggling, I should say, you know, that's the role of the quarterback. You get a lot of the accolades and you get a lot of the blame. And, that team's struggling right now.
Yeah, it's tough to see, but...
Tough to see. I mean, he lost a great player, and Devontae Adams went to your team, the Raiders, and so... I thought maybe they would offset that in some ways. Part of that's coaching, part of that's experience, you know, in my humble opinion. And so I'm sure they'll figure it out, but a loss of a player due to a trade or a loss of a player due to an injury, a loss is still a loss. It changes the dynamics, you know. Injury-wise this week, yesterday, just in the Chargers game, there were a couple significant injuries. And one that I saw throughout the league that was common, you know, it seems weird that things kind of trend. A couple weeks ago, we had a lot of ACL injuries early in the season. Week 2, week 3, we had a lot of ACL injuries. This last week in particular, at least I saw a lot of high ankle sprains. And so even though we touched on it last week, I wanted to talk more about the high ankle sprain, maybe just even briefly, because I had a couple patients in the last 24 hours be like, he's out 6 weeks for that? He's out 8 weeks? Thought it was an ankle sprain.
Right.
One guy said, I sprained my ankle and I had an intramural game at the YMCA. I played the next week. You just tape it up. I said, if he could tape it up, he would tape it up. Believe me, they played through a bunch of stuff, taped up, and a bunch of other stuff just to be out on the field.
Right.
And I said, hey, did you see the play? And he goes, no, I didn't see it. And I said, well, if you didn't see it, then, you know. When, in particular, Mike Williams on the Chargers sprained his ankle, high ankle sprain, they reported it. But I saw it on slow-mo. I was watching the game on TV, and, full body rolled up on, you know, it could have easily been a fracture or a break. He walked off the field. They didn't cart him off, but he was putting no weight, no pressure on it. And that's always alarming to see. You're hoping that it's not broken or fractured. You mentioned the other day, sometimes high ankle sprains might take just as long as a fracture to heal. Those are very painful injuries. You see them in basketball frequently. You see it in football as well. And there were several this week. I don't know if you saw any of the games that had any.
No, but I went through the NFL injury report like we always do. You know, that's kind of the role of what we do. And I mean, it was like every other name it seemed like had ankle issues. So a lot of ankle stuff. And I'm kind of attributing that to from the kinetic chain of things. You know, we are, you know, week 7 or 8 now. What
going
is it?
into week 8? We just completed week 7.
So I'm off with our podcast kind of. I mean, on and off. But, I just think, you know, the guys are getting fatigued. The hips are getting a little fatigued. You're going to change the mechanics of things. You're not going to be as agile. You're not going to be moving. It's very hard to play on Sunday, get ready, you know, because then they have the rest day, and then they're back at it, and then they're practicing Wednesday, Thursday, Friday, and then traveling. It's very hard to recover day in, day out and have the mobility and the flexibility you need to avoid certain things.
Correct.
So that's why I think we're going to see more and more, or we do every year. We see these ankles at certain times of the year because you can't move your leg as fast as you normally would week 1, 2, or 3. So you're not as agile. So your leg's going to be hanging out there a little longer, and you're going to get rolled up on these a little easier. And as soon as you feel some weight on a guy next to you, you're not moving as quick because your hip flexors are tight or sore. So I think that is, in my opinion, something that contributes to that. Seeing that a little more.
Well, the fatigue is real. You know, we're going into week 8 now. It used to be a 16-week season.
Right.
So week 8 was like, hey, we're at the midway point almost, and then they added a bye week. So it was 16 weeks with a bye week. And now it's 17 weeks with the bye week. And so, we are approaching almost the halfway mark of the season. And I think bodies do start to break down, especially if you're not getting regular body work. So, in my opinion, getting body work during the season when you're already hurt or already sore, it's almost like trying to save money when you already got debt on your credit card.
Right.
You really have to start that preventative pliability work in the off season. Me personally, I can go harder when you don't have a game in 4 days, 5 days, or a week, or consecutively. Sometimes the frequency of it adds up. If I slugged you in the chest, not going to do anything to you, bro. It's one slug to the chest. But if I slugged you 1,000 times in the chest, it might start to leave a bruise, or it might, and so sometimes the repetitiveness of the weekly grind of the season that starts to break bodies down, or at least soften you up to where an injury does happen. And, the first thought that I had on Sunday morning when I got up and I was working Saturday night at the team hotel before our game on Sunday was, God dang, we're on a freaking short week right now. And although I loved playing on Monday Night Football, it sucks because then you have a short week. So everything gets shifted, and you might not think it makes a difference, but it makes a difference. It does make a difference, especially in football, I think, because you're on such a routine of game Sunday, Monday's half day, go home, recover, have your therapist, whoever, come by, stay at the facility. Tuesday's the player off day, coaches are working. Wednesday you go back, they're implementing game plans. Thursday they're going through their plays and walkthroughs, and Friday you're already on to the next week. And so everything was compressed. I don't think any of those injuries were like, oh, it was a 6-day work week for them and that led to an injury specifically. But those games I'm always like like just a little bit cautious, wanting to spend a little more time on the bodies than less time on the bodies, and also just kind of crossing my fingers and praying like, hey, hopefully everyone comes out of this short week okay. What's nice is we had this short week and now we have a bye week, so we have that extra time. But I always look at, if it's a major injury, I'm looking like, do they play on Thursday night and then have some extra time, or did they play on Monday night and now they're playing Sunday with less time?
One of the first things I always ask with an athlete coming in, what's our timeline? What do we have? We need to know that timeline because that changes how we're going to treat it. Yeah. So
just recently I asked someone who was out, not playing in the NFL season, like, hey, what are we working with? Like, are you trying to get back this Sunday, or are you trying to get back in 2 weeks or 3 weeks? Like, what is your mental target date? Because that's going to matter on what I do today.
Right.
If you're trying to get back on Sunday in like 4 days, then my approach to it might be not as aggressive and maybe more, let's just make micro improvements or flesh it out or prepare you to play, versus if, he would have said, hey, I think coaches or the team docs, or I think maybe it's going to be multiple weeks. Okay, then I can maybe go hard and not worry about you being sore tomorrow because you're sitting for a few days. So, to your point, asking what are we working with? What's the timeline? That's first and foremost, right?
Right.
Yeah. What else did you see injury wise? So there was a lot of high ankle sprains. I do kind of want to talk, just if we could just circle back for a second with the high ankle sprain. Why does it take so long? Because I had 2 people ask me that today, And, I had my reasoning, but what would you tell somebody?
Yeah, well, the high ankle sprain is going to affect that tissue between those two, the tibia and the fibula, those two longer bones in the lower leg. So, whereas the low ankle sprain, you're dealing with little ligaments down there.
Like literally in the ankle at the furthest part of your lower leg.
Yep. And so there's typically 6 main ones, 3 on the inside, 3 on the outside that we're typically dealing with. And so those we can immobilize a little different. Those can heal a little quicker, they're weight bearing, but not involved with too much more than just holding bones together, whereas that tissue in between the two long bones has a little different blood supply, not that much blood supply, so it takes a little longer for it to heal. Yeah, and then we got the twisting component, right?
The rotational
component in there. So that's why it takes a little longer typically to heal.
Yeah, and I think that tissue is, in my mind's eye, it's thinner, right? Like if you think of your calf, your gastroc muscle, it's thicker, and so obviously more vascularity there. It might heal quicker. The guy who asked me earlier today said, well, why is it 6 weeks, 8 weeks? Like I was saying, he's like, I was hooping the next week at the gym, and I said, well, putting up 4 points and having 6 turnovers at the YMCA is different than playing in an NFL game. But he's like, is it really higher, or is that just a term? I said, no, it's a high ankle sprain because anatomically it is up higher on the leg as well. It takes longer to heal, like you said. It hurts, man. It hurts like a broken bone. I've done it before. And, say I have a low pain tolerance if you want, but I was like, I broke my leg. Like I broke my, I know it's broken.
You're for sure. Yeah.
I'm for sure, bro. You don't have to take x-rays. I'm telling you. And then the x-rays were negative. And I said, your machine's broken.
It hurts too bad.
Yeah, it hurts too bad.
Yeah.
I'm tough. So, I saw one particular, play this weekend where a linebacker was going to try to recover a fumble. So it was a pitch on a play to a running back. The running back kind of mishandled it. The ball was loose. Live ball fumble. Linebacker dove. Running back dove to try to recover it at the same time. Linebacker being a little thicker. They both kind of collided at the same time.
Yeah.
But what was scary / interesting is the person who fumbled it, when he went and collided with the linebacker, his neck went into extension. It's almost like they hit heads, but one guy's head kind of went down, the other guy's head kind of went into extension and back, and he was hurt and he wasn't moving. And right away I was like, oh man, that could just be a stinger. It could just be like, wow, that was a weird hit, or it could be something serious. It turned out he was okay-ish, but that was scary to see, and it's a reminder that it's a game of skill and precision, but it's still very aggressive and rough.
It happens that fast too. I saw the same play
like that, right?
It happens. Yeah, it happens so fast, and they were both going for the ball. They both weren't thinking. I mean, that same play, head-to-head contact like that on a quarterback, on a rushing or they blitzing in and hitting the quarterback, you can't do head-to-head contact. But this was spur of the moment. They're both going for the ball, not even trying to make contact, just going for the ball.
Yeah, it wasn't like a tackle, person on person.
Yeah, so that's how fast these things happen. So, and that's why there's no penalty or anything. Not that there would be, but yeah. And I think I even texted you that linebacker's head was twice as big as That's what I said. Yeah, I mean it was huge. So I mean that the running back's not winning any time on that collision.
Usually.
Yeah, so
not usually. Yeah,
he didn't stand a chance on that. So, but luckily it wasn't any worse. But that's kind of like a neck strain, maybe that same mechanism with that extension going back real quick like that, where you strain the muscles and sprain the ligaments, just like a real quick rolled ankle. Okay, so that's kind of the same mechanism, because people, if they hear a neck strain, I say, well, it's the same basic, injury as in your ankle. Everybody kind of understands the ankle injury.
They really do. I use that as an analogy all the time.
Because people either have had one or know somebody. So they kind of, okay, well, it's the same thing. You got ligaments, tendons, bone. It's the same kind of mechanism, just in a different joint. Yep. And then they're like, okay, so.
That resonates.
That resonates. So that's how I explain it.
I said that with somebody with a low back issue. We worked on the low back. My appointments in the office are usually 15 minutes. And this particular appointment was 30 minutes. So it was like chiropractic with some physical therapy. And so we did some cupping, some Grafton, some stretching. You know, this person had a low back injury. She's running a lot meaning like over 5 miles a day. And she, you know, came in with some back pain. We worked on it. It felt better. It was not unfamiliar. And we finished the session. She said, so should I just go on like a short run, or can I just go on my normal run? And I said, what would you do if you had a sprained ankle? She's like, well, probably, you don't want me to run? And I said, you got it. Like, that's it.
Your own,
Like, we just worked on your back. You're going to go run and compress it, and just all this pounding. And also, where are you going? On the concrete? The convention center stairs? That's like, I'd rather you, if you were going to do it, do something else, you know, or go not be on the hard pavement. And so I said, you know, if you had a sprained ankle, what would you do? And so it's a good point of reference, because I think with certain injuries, if you've never had it, you're like, well, it just hurts. And if it doesn't hurt, what can I do? And it just makes sense. You're like, oh, well, that's obvious. So that's interesting that you do the same thing.
Yeah, that's funny, because everybody that's had an ankle thing, they can, most of the time, I can get up and I can walk straight. But as soon as I start pivoting or twisting or rolling a certain way, that's when I feel it. Well, it's the same thing with the back a lot of the times, or the neck. As long as I stay still, I'm fine. But as soon as I turn my head, or as soon as I lean back or lean forward, that's when I feel it. Well, it's just like an ankle sprain, you know, in that sense. So But
I was just pausing for a second because I was thinking of her, and I'm pretty sure she probably went for a run the day after. She's like, well, he said only one day off, so I'm sure day after tomorrow I'm good. But I mean, sometimes people are a little bit aggressive with their habits or with rehab, which is okay. I like people who are aggressive with the rehab and attack it, as long as it's not beyond their limits, you know? So can I bring up a couple other NFL injuries that I saw, just kind of at random names and injuries, and you can pause me if something sounds interesting or you want to talk about? So we mentioned Mike Williams with his high ankle sprain. They said that he's going to miss, quote unquote, some time. That could be, 2 to 4 weeks. It could be 6 to 8 weeks. Hopefully it's on the shorter end of that time span. And, treatment wise, we didn't really touch on what you could do on that. But adjusting the ankle is a real thing if and when it's ready. You don't want to adjust the ankle if ligaments are torn or stretched. But doing any sort of soft tissue work can be helpful, in my opinion, to flush out inflammation or kind of, give those muscles and ligaments some TLC. Doing something like, I call it 1980s sports medicine, when people do like ice, ultrasound, or e-stem. But all those things are effective, There's nothing wrong with any of those things. But you could do something a little more advanced, like PEMF, right? Or you mentioned hyperbarics. That would be helpful too. So
keeping it simple, I like using a lacrosse ball on the bottom of the foot. There's 26 little bones in there, right?
I was about to ask why on the bottom of the foot for a high ankle sprain.
Right. So if one of those bones is off and it's going to change the mechanics of the foot, then the force has to go somewhere, and it's going to go up the chain, right? So I always typically have my patients start working on their feet, because they can sit there and roll the bottom of the foot out, front to back, side to side, little circles, and at least they
get feedback.
Yep, exactly. And they'll know which angles are triggering, which aren't. So it's nice feedback, but it gives them something that they can do while they're healing, right? So we try to find things that they can physically do during that time.
To be proactive with it.
To be proactive and to start right away, get them blood flow and oxygen to the muscles down there, and get the bones moving. And then I work up the chain, and then the muscle behind the knee, behind the knee on the calf side, is the popliteus muscle. A lot of times, especially with the plant and twist, especially with the high ankle sprain affecting that fibula, that popliteus goes up at an angle like that. And I like to put the lacrosse ball behind the knee, kind of pull the shin into the hamstring kind of, and wedge that ball there. And then they can point and flex within their comfort zone.
Smart.
Point, flex, side, roll one way, roll the other way. And in the beginning, it might be just a thought, and it's just wiggling their toes, but we get the thought process going, and at least we're telling the brain what we want the muscles to do. And then each day gets easier and easier, but the key is to do it within the pain-free range of motion, because if we're supposed to be doing something good for it, but it hurts, in a way that the brain's trying to pull away from it, then it's a negative feedback loop. So we want to send a positive feedback loop saying movement is good, not bad.
Right.
And so whether it's the ball in the bottom of the foot or behind the knee, and we're doing that self-myofascial release, we want it to be a positive feedback saying, okay, I can do this. And then the next day when we introduce it, the brain's like, okay, I remember doing this. It wasn't bad. Let them have a little more range of motion.
Yep.
And then each day it allows more and more because we're not cranking it down. We're not pushing through it. Because if each time we push through it and make it hurt so good type thing when it's injured, the brain will say, fight or flight. It'll release endorphins, so it'll feel good for about 45 minutes later. And then when the guy's gone with either the thumb in my calf or the hypervolt, digging in there, then the pain will come right back because then everything tightens up, goes in protective mode. So we don't really progress. So each day we feel this temporary 45 minutes to an hour relief and go, oh, good, it feels so good. And then, but we're never better. So when patients come in, oh yeah, I've been fulminal the heck out of it, hurts like hell, or I've been hypervolting, and just like on Instagram, it's vibrating and all my muscles are shaking.
Like beating up your hip flexor
and
for
so
40 minutes.
The brain is literally fight or flight. Like if you came after me, I'm going to hunker in and I'm either going to fight you or flee, and my endorphins are going to be high, and so I'm going to feel good. And then as soon as the threat's gone, then I can settle down, and then the pain starts coming back. So when I see people say, oh yeah, I do it, but it's only temporary. Well, therapy should not be temporary, unless
it should have a lasting positive
we
benefit.
Should get some kind of benefit out of it. Now, I always say collect those temporaries, but those temporaries should feel good, right?
Yeah.
Not revert right back to where it's no better.
Dude, we have so many like parallels and similarities, and we never really talk about those things, but I'll often say, hey, we're doing this right now so we can take, 2 micro steps forward, because I'd rather do that. And then next time we'll take 2 micro steps forward and we'll stack those micro steps rather than, I could hit you with everything I have in my bag and do, all the things, right? And you might feel good for today, but then it's like taking 3 steps forward and 2 steps back. Right. It's like, that's a net 1 gain,
right?
But you've had a slip back, and that's not good physiologically. It's not good mentally. Right. And so, stacking wins without any slide back is really how I've had a lot of success. And so I stick with that.
Yep. Me too. So that's those are the 2 basic things I would do, above and below that high ankle sprain. Yeah. And that way it feels productive. We feel like we're doing something, and that's easy with a little lacrosse ball, tennis ball, whatever, No,
that's right
good.
on. Yeah. That's right on. I think people always go to the area and not further down, whether it's ankle or foot, if we're talking calf or high ankle sprain, and not further up either. Yeah. The popliteus behind the knee, the hamstring, and then flip them over. Quad, hip flexor, all that is. So you could go many layers, not just 1 connected, but 2 connected, 3 connected, all the way up the chain.
That's why a lot of times people call you up, hey, I just rolled my ankle, it's all busted up, swollen, just got an x-ray, no fracture, when can I come in? I'm like, come in right now, because today. We might not be working on the ankle, but we're working on the chain. We're going to start the process today. There's always something you can do.
You don't have,
but a lot of providers will be like, well, you need 72 hours, let the swelling get down, let the pain get down.
I'm trying to see you
then
right
I'll
away.
see you. No, like, how
right
fast
away.
can you get here? Like,
honestly.
I'll meet you halfway, type thing. Yeah. But the sooner we can get something going on, the better. So
in a perfect scenario, one, I've talked about just being able to, I don't know what you call it, like time warp to certain positions, right? But, I'd like to be available for all athletes that I treat, even college, high school, whatever, to witness them at the practice field, to watch them, after games. And as soon as they come off the field, like in a perfect world, before you go to meetings, or if you're in meetings and you did something to your ankle, 45 minutes after you did it, I'm over there doing something. And I know that they get that treatment at the facility with the team doctors and all of that. But just, to your point of, should I wait? Should I do it now? No, come now. Come now. Yep. We can do something positive. Yep. And taping, we didn't mention that as well.
Oh, yeah.
For things like that, if proper tape jobs can
Day one
help in between the treatment. So if you're getting the best care for an hour, that's 23 hours that you're not getting care, right? And maybe some people are getting multiple sessions a day, but in between when you're not, a proper tape job can at least help facilitate things moving in a positive direction.
Yeah, there's a great tool out there. I don't know if you had much experience with it, but I like you mentioned, okay, when you leave the office, there's 23 hours.
Sure.
The Firefly device, I've used that a lot on my patients. So it's a little...
Gosh, dang, that's crazy that you say that, because in the team elevator this weekend, this was Sunday morning, team's having breakfast before the game Sunday afternoon, and I'm done with my treatments. I didn't have any treatments Sunday morning. But I went down to where they were eating and was just, being available to say hello, good luck, whatever. And, I saw a guy that had it on his knee, and I was almost going to ask him, but I was in the elevator with another gentleman who was, well, you work the front office. So this guy was in a sports coat and slacks. I was in like jeans and, my scrub top. So if I was to guess, he was probably some sort of medical staff for the team. I haven't met him before. Some changes over the last 2 years with COVID and whatnot. But getting to the point, since I interrupted you, is this player had a thing on his right below his knee, and it said Firefly, and I was like, I'm going to look that up. And the other gentleman said, hey, what is that you got there? Does that work? He said, oh, it's like a little TENS thing. Yeah, it kind of helps. And so I took a little look at it, and I meant to look it up. So
it's not a TENS. It's not. So we'll go into it sometime.
What's your quick
little different frequency? So it's a reverse of that frequency, like TENS and STEM. TENS is a transcutaneous electrical nerve stimulator, right? So it's affecting the nerve. STEM is affecting the muscle. So what they did basically took the technology where they flipped that wave. If this normal sine wave's like this, they go like this, right? And basically it's a non-fatiguing contraction. Okay, so it's a long, slow contraction, but it's affecting the peroneal nerve on that. So what we're doing is, what it's doing is causing a little foot contraction, and it's causing that, it's pumping oxygen and pulling out metabolic waste throughout the whole leg. So I know the owner, very effective. So I know the owner that brought it from Europe. It actually started in Europe it was a medical device in Europe. And so what they would do is they found that patients after surgery for blood clotting were not compliant with the big boots, the compression boots.
Sure.
Patients just weren't using them the way they should. So these people developed this unit that would just stick on there and stimulate. And what they would do under, what do you call that? Where the heat, where you could see the blood flow. Oh my gosh, my head's going. But anyways,
diagnostic ultrasound.
No, but they could see how much blood flow and oxygen was actually. Nope, we'll just keep moving on. Sure. But it'll come to me. Infrared. Okay. They would see how much the blood flow and oxygen was actually pumping, and they actually saw that it was actually doing just what they wanted out of the compression sleeves for that whole leg. So it's unremarkable. Or unbelievable. So it's a really good tool for pumping in oxygen and pulling out metabolic waste. And it's something, because it's not contracting the muscle, if you have something that's a little more significant where you don't want that contraction. So if you don't want a lot of muscle contraction because you want that tissue to heal, it's just a light flutter. Like I have my patient that had that ACL surgery. We got it on her right away because she could be doing it at school. You can turn it on and off. There's 7 settings. You can turn it on and off.
Man, let's talk more about this.
It's really cool technology to send your patients off with it, and it's cheap. It's got so
I mean, not to talk about stuff off air, but without getting too nuanced on this little side tangent, I do want to learn more about how you use it. And just while you were talking, there's 2 or 3 people I can think of off the top of my head, professional and otherwise, that maybe that would be something that would be helpful.
100.
Okay.
So we'll talk about it.
Dude, that's great. It's so weird, the weird synergy, because I literally saw it on his knee and I was like, what is that? I thought it was like a wristband sometimes you'll wear for not sweating purposes, but more, you want to look cool and, and so I thought it was like a little, he was getting banded up before the game, before he even got on the team bus. And
they're great.
Luckily the other gentleman asked him what it was. So
they're nice because, like I said, before games, it does not fatigue you out.
Okay.
So literally you can dump tons of oxygen.
Firefly.
Firefly.
Okay. I'm going to talk to you more about that this week then. Let me just run down a couple other players and injuries. So the tight end for the New York Giants, he had an interesting injury. Did you hear what happened to him?
No, go.
He fractured his eye socket.
Oh, I did read about that.
Yeah, he fractured his eye socket.
Yeah.
And so
it's not all I read was that he had an eye injury, but I didn't hear what happened. So
I didn't see the play. I do a little reading, I'm sure, like you do, about what's happened in the league every week. And I read that, and they said, they're not sure about his return time as of yet, but a little bit of an unusual injury, and hopefully he's not out for the season, depending on if there was any damage. They were kind of superficial about it, but I'll find out more information by next week.
Well, that's a gnarly one too. The first one I ever saw, you were there, was in Davenport, Iowa. Our buddy Joel, our quarterback.
That was wild.
That
changed my whole...
Yeah, took a knee to the face.
My whole not career, but my whole chiropractic experience changed on that play.
Yep, busted his face and raccoon eyes.
Were you playing at that time when that happened, or were you on the sidelines? You were
playing.
So I was on the sidelines. Just for a little context, we had this football tournament through our chiropractic school, and we traveled throughout the nation to play other schools. And this particular tournament was in Iowa. It was our first year in chiropractic school, so we were year one.
The youngers,
And they already had kind of their senior team. They were like, but what was funny, actually, we came on as our class as freshmen or first quarter guys to the football practice, and they kind of already had their squad. And I remember they're like, well, you guys can be the B team. We're like, fucking B team. All right, we'll be the B team. And then I remember we whooped the A team. And I remember that other quarterback, Joel, who was a really nice guy. I was like, bro, I'm faster than that guy, and I can throw better than that guy.
He was a hockey guy.
And we had so many dogs on our team. Like, we had so many players. I just was like, okay. And as I recall it, you correct me, because I think you're maybe have a little better memory, but we used to whoop them in practice all the time.
Yeah, well.
So we go out to this tournament. Joel's the starting QB. I'm backup DB, playing defense only. So I got my gloves on. I'm on the sideline just catching passes, thinking like, oh, I'm gonna get a pick today, probably. I didn't expect to play at all. Third play of the game, he throws an interception, the quarterback for our team, and he goes to make a tackle for some reason and took a knee to the face. I didn't see any of this happen because I'm literally the game just started. We kicked off. It's the third play. Like, are they scoring a touchdown? I don't know. I'm playing defense. I'm warming up on the sideline. And I hear somebody say, P, start warming up. I was like, warming up for what?
Yeah.
And I look, and all I saw was Joel just bleeding on the field. And I said, oh, shit. And my heart started racing. I was like, yo, I'm going into play right now. I didn't even warm up. I hadn't even thought about plays, or like I wasn't even anticipating playing any quarterback. But that was fun because I got to, unfortunately for Joel, he got hurt. But we ran that whole tournament and played in the championship.
I was going to say, I hope you remember that. Yeah.
So I also remember losing that game for diving in the end zone. And it was like the game-winning dive, and then they're like, oh, you can't dive in the end zone. And I was like, well, that should have been.
That was right there.
Should have told me that.
Yep. But, we had a nice run.
Man, that was fun. Good. That was a lot of fun.
We'll have to dig out those pictures someday.
So that's what happened to Joel, huh? He busted his eye socket? I remember he had 2 black eyes, busted nose.
Yeah, I remember seeing the MRI or the CT, I forget what he had done, but the worry was flying, if he'd be able to fly because of the pressure.
Gosh, dude. Yeah. Everything got so whirlwinded because we had multiple days, multiple games a day. And all of a sudden I was like, yo, I didn't even bring a playbook. I was writing plays. So I was like so in my head at that first tournament because I was like, oh.
Well, we scrapyarded.
I don't want to lose. No, we made it all the way to the championship. We did good.
We
lost to a bunch of rugby
plays
nerds.
in the dirt, though.
Yeah. That was a lot of fun, but damn, poor Joel. Yeah. So I didn't realize that was a significant injury. That's what he had, huh? Damn, that's aggressive. So that was interesting with the Dallas tight end. I thought that was different.
I'm wondering how he had that happen with a face mask.
You know what? I'm going to do a little reading on it and find out, because I was curious, like if he somehow like a hand got in, or maybe the chin strap came off or something. It's just a different type of thing, and he's a tight end, so I mean, I wonder if it was a collision. I'll find out. We'll talk about it next week. The Jets guard, Elijah Vera Tucker, he had a triceps injury. He's out for the year. So that's, all these out for the years. That was one of them, a tricep injury. I'm assuming it was probably torn. Another out for the year was J.C. Jackson. Recently, it was just released. So he had an injury yesterday. He's a defensive back for the Chargers, was covering on a play. Went down before the ball actually got there. It looked like kind of midair. He was grabbing his knee. And they reported he dislocated his knee, more specifically his patella. So it came out later on that he had ruptured and torn his patellar tendon. So it looks like he might be out for the year, as that's a more serious injury. Then when they said he had dislocated his patella, I was hopeful, okay, maybe maybe it's weeks and he'll be back by the end of the season.
Yeah, those are painful injuries. I've had a couple of those come through my office, and they usually, relocate by themselves because it's one of those things. It happens either from impact or planning and twisting, and the kneecap slides out of that groove. Remember we were talking about that V type groove where the kneecap fits perfectly in that like V groove of the femur and the tibia right there, and it just slides up and down, and then the contraction or the hit happens so hard it slides out laterally usually, and you get this big old patella on the side of your leg, but you're stuck in a flex position. Usually either when you come down or because you're freaked out, you kind of go to extend and it'll pop right back. But just like anything else, when that happens, you rip up stuff.
You don't know if it's down. Even if it goes back, you could have a stretch of those ligaments or tendons, or a tear of those ligament tendons, or both, depending on.
And sometimes you can have some chondral, osteochondral issues where the bone and the cartilage are
avulsions, whatever.
Yeah, so that's so when you're hearing that in the news, and depending on what structure's actually been damaged, that's what's going to determine how long it takes. So that's what it'll be interesting to see, actually what comes out.
Yeah. So there was that one. There was the Jets running back, Breece Hall. He tore his ACL. He was really having a great couple games, great year. Kind of a bummer for the Jets team as a whole. The Giants being 6-1 is kind of a surprise. They've had a few injuries this year, but for the other New York team, the Jets, that was a big blow with Breece Hall tearing his ACL. David Njoku, the Browns tight end. He also had a high ankle sprain. I probably mispronounced his name, so apologies there. But his ankle sprain, they were saying, is maybe a little less severe. They were saying 2 to 5 weeks from the team. All that's kind of subjective, right? It's just kind of an estimate that you have to give out. It's more like, let's see how week 1 goes, and then we'll know better if it's a 2 to 5 weeker or 6 to 8 weeker. You can kind of tell depending on. Maybe if they take an MRI, see what's torn, you can have a clearer idea.
And a lot of these higher ankle sprains happen too because a lot of times they'll be run-of-the-mill rolled ankles every game, and they tweak their ankles, they're sore, and they don't have to report them. They're not an injury, but they tweak them a little, and so then they're practicing on that, right? And so a lot of times we see all these reports of high ankle sprain. How could this happen? But a lot of times it started week, 3, 4, 5, and it just progressively got worse until something actually took it over the top.
Fatigue, and then break.
Yeah. So because they're not given that time to properly rehab it, they're taping it up. They're doing.
Yeah, if it was you and I, we'd be like, okay, we're not playing in the rec league for 4 weeks, right? And they're playing every 7 days, every 6 days.
It's a gamble, hoping it doesn't go worse.
I want to touch on something a little bit unrelated to a line item of everyone who got injured in the NFL. People can go to NFL.com and read there's dozens of injuries every week. We bring up the ones that are interesting to us, or the ones that people might ask me about, or maybe topically that, we feel like we might want to explain. But I saw something this week, yesterday evening, I think it was, and I showed you right before when we were having a little bite to eat next door. Actually, shout out to Make Pizza, by the way. Yeah. My neighbors make pizza next door. They, not only are they best pizza place in downtown, but they hooked us up with a little free food and drink beforehand. So I wasn't sure if I was going to fall asleep on this podcast or be hyped up from the food. But
it was so good, and we just kept eating. I
appreciate the both of them.
Must stop anytime anybody's down here.
I forgot what was I saying there for a second?
You were talking about one of the cases that you were showing me.
Oh, yeah. So what I was going to say was when I was showing you when we were having some pizza there is I saw another MD tweet out a statement after J.C. Jackson got hurt. And, well, I'm talking to you. I'll just be frank. It kind of pissed me off, And what he said, if I'm going to paraphrase, I don't want to pull out my phone and look it up right now. But basically, he said about a player, I think I already mentioned it, J.C. Jackson.
Yeah, you did.
He said... oh gosh, this could have been preventable if the team had taken a diagnostic ultrasound of the patellar tendon. Yeah. They would have seen that it was frayed or sheared and this injury was preventable. Now that it's a torn patellar tendon, this could risk his career. Yeah. There's negligence or, and that it's like, bro, you don't know. You're not in the team room. I never pretend to know. And I have, a micro layer of proximity, right? Yeah. And so for some random person to have some opinion that's so strong that maybe fans might read, or his family might read, or that maybe he might read because he tagged him and said, hey, the team should have XYZ. It's like, you don't know that, and so that kind of irritated me. And I wanted to make sure that on this podcast, we never speak on something that's not factual. Yeah. And that if I do get, I want you to check me on that, Right. I don't think we do that, but I read that and that just rubbed me the wrong way.
And when you showed me, the first thing I saw that he had bolded things, bolded, I think, preventable.
Right.
Injury preventable or something. And it was very inflammatory and very accusatory. There was no need for that. And I think you were saying it, he's just looking for retweets, That's the only thing we could think of, right? Because why, as an MD, would you put something out there like that without all that, backstory? He I don't know. It'd be interesting to see where he's coming from on that. But
I didn't dive too down the rabbit hole on it, to see whatever, try to figure out. The one thing that I don't do, Dustin, is I don't try to figure out why people do things. Honestly, it's kind of like one of my rules of life is like, hey, if that's what you do and I don't agree with it, I'm not going to try to figure out why you do it. I'll accept that that's what you do. But in this particular case, it was just like, God, this is people's livelihoods and lives. And for someone to plant that seed, I guess, like you said, you're open to your opinion, but reading that kind of irritated me. I was like, God, you don't really know. And how do you know, and why are you saying that with such conviction? Because like you said, maybe it was the all caps that, kind of, I was like, who is this guy? And like, why is he, stirring the mud a little bit? So, anyways, that was a little disappointing to see, but you can't have control of everybody and what they do. And
I think it was just a good reminder because we're more intimate with it, with the having relationships with the teams and players and stuff. I think his audience are fans maybe, and they're going to have a different response to that. They're going to be more in agreement and supportive of him saying, because they don't know.
It's just not my style, and so I'll leave it at that. It's not how I would do it, and I don't like to speak on it like in that manner. But I saw that and I was like, damn, I'm going to show Dustin this.
Maybe we call him up and ask him online.
Might not be a bad idea. I'm not shy.
No, to get his opinion, because then we can learn something.
For sure.
Like why,
That's your homework.
There we go.
I learned something new this week.
Yeah?
I wanted to share with you. It's something that I already knew, but it's always nice to read something in print from a reputable source that's new kind of research, right? And so since you have kids, I read this article this week. Every week I'm trying to, kind of absorb some new information. And one of the things I read this week is that, newsflash, sports are better for youth or for the young athletes. It's better for bone health than running alone. So they compared youth who played sports with youth who just only ran and didn't play sports. And what they found was that young athletes essentially have better bone health. And in this case, I think they mean like bone density than people who just run alone. So the conclusion was just that like, hey, have your kids play sports. It's good for their bone health. It's good for their, in this case, I think they were speaking of bone density, but they made a comparison to playing sports and just running alone. What would you attribute that to, knowing that?
Yeah, so interesting. I'd love to read that article because I love diving into it and figuring out what's the control, what's the variables.
Sure.
But from a knee-jerk response, I think if they're talking about just pure running versus sports, playing on teams, I would think it might be something to do with the change of directions. And when you're playing with a sport on a team, or even if it's not, the chances of falling are greater than if you're just running linear.
Sure.
So you're going to be hitting the ground more often than not.
Yeah.
Playing team sports, whether it's soccer, baseball, softball, volleyball.
More impact.
You're making contact with the ground more when you're participating in sports than if you're just jogging, right?
Yeah.
If you're falling when you're just jogging, then you're probably injured at that point.
Yeah, you tripped or something.
You're falling and hitting the ground and rolling around and tumbling is part of sports. So, so I would contribute it to some of that impact, even on non-contact sports. like baseball and softball, you're still sliding, you're hitting the ground, you're still diving for balls, you're still, making contact bat and ball, so I would contribute it to more of the force type things.
To that,
Yep, and change the directions.
That's
your body's
kind of
having to
too.
respond.
It wasn't, a big
aha
moment,
no.
but just it was.
I
read the whole article and I was like, obviously,
yeah.
But I could see maybe using that with some of my parents who have young kids who are maybe playing athletics. You get questions all the time: what's safe, what's not. And so I thought you might be interested to hear that.
I could tell you something on that, and we should talk about this sometime.
Sure.
I have a bunch of divers, and
like scuba divers.
Divers like 1 meter, 10 meter.
Oh, I got you. Yeah.
Competitive divers, and the impact, especially from 10 meter, that they have on their necks, their shoulders, their hands, their arms, is unbelievable.
Really?
And it's not a sport I've ever done.
Yeah.
Except cannonballs.
Hey,
and
if I go in the water, I've fallen or I've been pushed.
Yeah, exactly.
I'm a land mammal. I'm not trying to go in the water, bro.
So that's funny.
Yeah.
So it'd be interesting to have that conversation.
Yeah, that's interesting. I never thought of that, but you're right. Gravity, distance, mass, speed.
Yeah, it's pretty interesting. I think after NFL, we should have certain sports like that and talk about dance, ballet, ballroom, dive.
I mean, we can
golf.
during the season too. I know we're pretty football centric during the season, but it's only because every week there's new injuries and it's
relevant right now.
Yeah, it's relevant. So along those lines, I'm going to bring up a couple games for next week, and then I had a moment this week where I paused and I thought of you. So I want to talk about that. I don't want to forget. So that's why I mentioned it now. But for next week's games, I wrote down 5 games. I want to see if any catch your interest. Thursday night football, Ravens versus the Buccaneers. Sunday night football, just to hit the primetime games, is Bills Packers. That also happened to be something that I was like, oh, this is an interesting game perhaps. Monday night football, Bengals and Browns. Typically not your entertaining game, but there's some stars on both those sides this year. 2 other games not on prime time: 49ers Rams, divisional game. 49ers just got Christian McCaffrey, CMC. The Rams, I heard, were trying to go for him, which incidentally the Rams got Matthew Stafford a couple of years ago, and the Niners were going for him. There was some other players. So those 2 teams do kind of vie for the same free agents. The Niners won this one. They play next week, so that'll be interesting. And lastly, the Cardinals versus the Vikings. So those are the upcoming Week 8 games. Any of those jump out where you are, thinking you might want to take some time and watch?
Lately, Brady and Aaron Rodgers, those 2 are like a train wreck to me right now. I just feel bad. I mean, they're so good, yet they're just struggling. I think there's a lot going on in their personal lives. Obviously, we've seen some stuff, but just I want them to succeed, and I always want the greats to go out well. Yeah. And I just hate seeing this. So I'm like, every week I'm rooting for them to have success.
It's almost like the Twilight Zone.
Yeah.
You got Geno Smith winning games, and you have Aaron Rodgers and Tom Brady's losing games, and it's a weird thing. The Giants are 6-1. Geno Smith is beaten teams, and I'm happy for Geno. He was on the Chargers as a backup. And I liked his quote where somebody said to him, they wrote you off. And he said, are they, what specifically he said? He said, that's what they said. They said, Geno, they wrote you off and here you are winning games. He said, yeah, they wrote me off, but I didn't write back. And I thought that was great. Good he also said one other thing where, how it is during practice when people are like, the one's over here, the two's over here, just like us with Palmer, right? They said, we're the ones and we were the twos, right? Until we started beating the ones in practice. But he would always tell Coach, hey, Coach, don't tell me to go with the twos. You got 2 number 1s here. You don't got no 2s here.
Nice.
And so I really like that attitude from athletes, and I'm pulling for Geno to do well. But to your point, it's weird to see legends of the game, right? Yeah. Aaron Rodgers. I mean, obviously Tom Brady with all the rings, but if you talk about fundamentals and spinning the ball and making all the throws, Aaron Rodgers is right there. Yeah. I mean, he is there. He is, he is one of the greatest too. Just doesn't have the rings, and so that's interesting.
And I
Some
grew
good
up.
games next
I
week.
grew up watching. We had Rams season tickets when they were in Anaheim, and so I grew up with that Ram 49er rivalry.
Yeah.
Since the
Was it a
80s.
rivalry when I was younger? It
Come
wasn't
on,
much of a rivalry, bro. The Niners kind
It
of.
depends on whose house you were at.
Yeah, that's true. That's
but
true.
no, it was fun. Always having them come through the tunnel, and we had the melon heads back then in the '80s, and they would have to come through and run through the tunnel, and we'd give them a hard time.
Yeah.
So I always, even though I'm not a Ram fan, it's not the same as when I was growing up, but I still like those rivalries.
For sure.
Yeah.
Yeah. I mean, I still have love for the Niners. That was my hometown team until I started working with a lot of Chargers, and they became my team. My worst nightmare is a Charger-Niner Super Bowl.
Yeah.
God, I mean, also the best because that means the Chargers are there, but I'm going to speak on it right now. No, it's clear as day. I'm pulling for the Chargers. The Niners already won a whole bunch of Super Bowls. Just relationship-wise, I got to pull for my guys, you know.
That'll be fun.
Well,
so what else was on your mind?
Yeah, man. So I don't know really how to tie this up, but I had a moment where I realized something. Somebody that I'm really close with met somebody that you're really close with. And at the time, I didn't know that you were close with them, and they had a moment together, and I thought I'd bring it up to tie it all together because I thought it was kind of a beautiful moment. And so it has to do with my good friend Corey Leggett. He just retired from the NFL, 10 seasons in the league. He played 8 years with the Chargers, played it with the Bills, played with a couple other teams, the Colts. And so this past weekend, the Chargers honored him, and he had a little ceremony type thing. He was at the facility, and so I'm really happy for him. Playing in the NFL, the average is 3 years, 3-point-something years. He played for 10 years, and what I'm most happy for him about is in his 8 years with the Chargers, he played 103 out of 108 games.
Wow.
And it's like, other than Phillip Rivers playing 220 something and never missing a game, especially at his position, playing D-line, dude, that's awesome. Freaking amazing, Yeah. And so it was, I was really happy for him. But so I was going through my pictures and going through the, the articles about him and this and that, and I came across a picture. And so getting to the story part, at one point in time, I bought two of my good friends, Corey and Jaleel, a Mamba Mentality book. Right when Kobe came out with the book, it was out, and I was like, I'm going to buy these. They're probably going to sell out. So I bought 3. One for myself, one for Corey, one for my good friend Jaleel. And I gave them to Corey and Jaleel at different times. I gave Jaleel his, I think, maybe at his house or in a hotel or something. I gave Corey his, I believe, at the facility or after practice one day. I was like, hey, by the way, here's your book.
That's nice.
And he, it was... both those guys said they don't read too many books, and I said, "Hey, just joking. Like, there's a lot of pictures in this book. You might check this out. You might like it, But in all reality, they're fierce competitors, both those guys, and I knew that they would be able to have some takeaway from the Mamba Mentality book, so I gave it to him. And I think Corey took his to work and had it in his locker, and he said sometimes he'd look at the Mamba Mentality book while he was chilling before practice or whatever his motivation. I thought that was cool. And one day after practice, Kobe's had some business at the same facility where the Chargers are at, and I think you're familiar and you've been there before perhaps. And so Kobe came out, coaches said, hey, we have somebody to come speak to you after practice, and Kobe came out and gave us a speech to the whole team. And I think at that time I knew that you had a relationship with Kobe for like a half a dozen years. I didn't. I think at some point in time I put it together because we were talking about injuries, and I was like, well, this is way too coincidental, Right. And so you never spoke on it, but I think I put 2 and 2 together. And I remember my friend Corey said, hey, Kobe came today and spoke at practice, and dude, you gave me that book, and I took it to him and he signed it. And like, yo, I'm so happy you gave that to me. Thank you so much. He signed it, and they had this moment, and they took a picture together, and the article had this picture of Kobe and Corey together. And I sat back and I said, damn, that's crazy, because I bought that book for him just as a motivation, and I didn't know for a fact that you had a relationship with him, but I thought it was cool that somebody that I was really close to and somebody that you were really close to, unbeknownst to me and you, had a moment together. Yeah. And it really motivated Corey, or at least it inspired him, to meet somebody of Kobe's stature. I think there's a few people that even if you're a high-level athlete, you're like respect. Yep. And Kobe's one of them, obviously, right? Yeah. And I saw that picture and it,
I could tell you, man, just you speaking and you telling me the story, I started welling up inside too, because it's coming full circle, you know, and like you said, with the universe and everything, you telling that story, because I've been there, I've been with Kobe. I felt like I was there, and knowing how Kobe would respond to that, that's just a special moment. And the way Kobe is, you know, his Mamba mentality is, like I told you the other day, is it's always there, because the Mamba mentality is maximizing your full potential at whatever you do, right? So if you're going to love at the full potential.
Totally.
If you're going to be competitive, you're going to be competitive at the full potential, right? So in that moment, when somebody comes to him like that, he's all in, you know, so it's not superficial. You know, we'll talk sometime. I'll give you some stories of other things like that, but I can guarantee at that moment, he was all in with your buddy.
Sure.
And that's why when you were telling that story, I've been there next to him when he's signing things for people, and I know that's a moment. So that was huge. So
yeah, I mean,
and
I don't even know why I got kind of emotional there, but it was just cool to see that they shared that moment. And you know, I didn't know about your relationship, and it just seemed like it came full circle.
Yeah, well, you put that in motion, right? If he doesn't have that book, he might not be apt to go do that and talk to him, because all the whole team was there, right?
Yeah.
And so I'm sure that they didn't just stand in line waiting to meet him. I mean, I'm sure a few guys did, but that gave him a token to present and be a little more approachable at that point, because then it brought them together. There was this bond right there.
Had something to.
So, and you gave him that opportunity. So
yeah, it's really a crazy thing.
Why would you? You know, it's cool.
It's very cool. Yeah, and I think what touched me when I saw how happy Corey was with him, and Kobe was also smiling, and I was like, man, that's awesome, because it just seemed too almost coincidental.
Yeah.
You know, it was very fortuitous.
Yeah.
And so I wanted to share that moment with you, because I was screenshotting it.
I want to see that picture.
Yeah,
honestly.
yeah. And you know, and I was just like, man, the world works in mysterious ways. And then it also made me think, you know, I think Kobe would be proud of you for doing this today, right? Because you've spoke on him trying to tell you, like, hey, you should pursue this, write that book, do this thing, I'll help you with this, bring me some idea and we can work together. And, you know, I was driving back thinking, like, if he were here today, I think he'd say, Dustin, I'm fucking proud of you.
Yeah, thanks, man. That means more than you know, just saying that, because it's something that I resonate and or meditate on all the time. And, you know, we had a lot of those great moments talking about next level stuff. How can we be the better versions of ourselves? How can we help people be the better versions of themselves? That's where we had another common bond, and it was always, what are we going to do next? And, you know, and he was already at another level, and but it was a good. We're a sounding board off of each other in our moments together sometimes, and this was one of the things I always wanted to do. And
well, I know he learned from you some stuff, and I know that you learned from him as well. Yeah. And so anyways, I don't know if there's a point to that story other than in that moment, like I paused and I was like, God, that's really full circle, and that's a beautiful thing. And it made me think of you and the work that you're doing to come here every week. I know you're researching stuff and you spend time driving, and it's work, you know, we're taking time out of our day where we could be seeing patients or being with our families. And my thought was that he would say, way to go, dude, you're fucking doing it. And I'm proud of you. So I wanted to share those thoughts.
Well, I appreciate that.
Of course.
I know he is.
Yeah.
So,
well, week 8, we got one more week of football coming. We got another podcast in the books. I appreciate you making the time as always. I think we, you know, covered a lot of things today. And what I'm most appreciative of is these conversations that we have, whether it's about life stuff, whether it's about sports medicine, whether it's about, you know, stuff that we're going through or our patients are going through. I like to share those stories and get your feedback and your opinion. And so thank you for that.
Thank you.
No, absolutely. Well, like always, guys, we're recording here from San Diego. And we're here with you every week. Our episodes drop every Thursday. You can find us live if you want to watch us on YouTube.
Yeah.
As always, you can catch us on Apple and Spotify for downloads. And we thank everybody who is listening, the people that have reached out with some questions or comments. Those are always fun to see too.
Yeah, we've been getting good feedback, good and bad, so it's nice. That's how we learn.
It doesn't hurt my feelings.
No, not at all.
Like whatever the thoughts are, hey, improve this, or we don't like this, or we really love this. I'm all ears, and I always like to hear the feedback. And so truly this is just a project out of love. Mm-hmm. I like to meet with you. I like to talk what I know, which is sports medicine, and what I'm passionate about, which is sports and getting people healthier and having them be their best. Yeah. And I'm glad that we have this platform. And so if you like what you're listening to, give us some feedback, because otherwise I just think it's going out into the ether, and that's okay too. Yeah. But, it's good to have feedback and respond to that. So again, as always, we appreciate you. Until we meet with you again next week, stay safe and healthy. And I guess if you feel blessed, go be a blessing to somebody else this week. Absolutely. And we'll be back in a week. Look forward to it, guys. Have a good night, okay?
Thank you.
Bye-bye.